going out of an abundance of caution. Dr. Alexander, thank you so much for joining us again today. We're going to go ahead and start with, many of us have seen the graphics explaining how the virus can spread. We keep hearing about flattening the curve and how many of these restrictive measures could help. Could you first explain what the curve is and how following certain protocols could help?
Absolutely. So the curve, as you mentioned, is something that we're referring to the projected number of people who will contract the coronavirus over a period of time. So what you see is a very big, steep curve at the front end if we don't do something about it, because it's passing from person to person very, very quickly, and we don't have any way to stop it at this point except through something like social distancing. So if we're able to stay away and really take those extra precautions, as were just mentioned, then we can flatten that curve where there are less cases over time, and we will not inundate and overwhelm our healthcare system. Because what we're seeing is, in places like Italy, the healthcare system is so overwhelmed that they're having to turn people away, which at the end of it all could lead to more deaths. So we really are trying to protect everybody involved, the healthcare system, the patients, our entire community, and now everyone across the world.
And Doctor, we're seeing some drive-through screening areas, pop-up interviewing area, a couple of them, though, only taking people who have referrals. Why are some people tested and others not? And can you explain the testing criteria that healthcare providers are following right now?
So the biggest reason some are tested and some are not is because we don't have enough tests. And as unfortunate as that is, that's where we are right now with the situation. So what we are basing our testing on is testing criteria, starting with the symptoms that we've mentioned over the past couple of weeks of fever, cough, and shortness of breath or difficulty breathing. So we start out with the symptoms for starters, and then you have to meet one of 6 other criteria in addition to that. So you have to have had close contact with somebody who is a confirmed coronavirus, somebody who has coronavirus by laboratory confirmation, or you yourself are hospitalized with these symptoms. If you're hospitalized with fever, cough, shortness of breath, you're going to be tested. If you've traveled to an affected geographic area where there's widespread transmission, you will be tested. If you have the symptoms and you've traveled, you will be tested. If you've had international travel or come back on a cruise and you have the symptoms, you will be tested. And then if you're over the age of 65 with a chronic health condition such as heart disease, diabetes, lung disease, or if you're an immunocompromised patient with these symptoms, you will be tested as well.
And we keep hearing the term social distancing. Makes a lot of sense. I think we all understand what that is. But if someone is diagnosed and they're quarantining at home, obviously, if you have loved ones there, your wife, your husband, your kids, how can you quarantine at home and make sure that you're, I guess, keeping the people that live with you safe? You're protecting them.
That's right. That's exactly right. And great question. This is a tough one because if you are sick and you've been diagnosed with coronavirus, you're trying to keep it from spreading in your home. The best thing you can do is stay away from others. So stay in a bedroom that no one else is going to come into. Try to use a bathroom that others are not using. Wipe down those surfaces regularly. And if you have to, of course, at some point you're going to have to come out of the bedroom, maybe to go to the kitchen or something. Make sure you're wearing a mask, because if you cough or sneeze and you're within 6 feet of another person, or if that droplet lands on a surface and somebody comes behind you and touches that surface, you could risk infecting them. So stay in a certain area of the home, wipe down surfaces frequently, wear a mask if you have to be around others, and avoid sharing personal items such as dishes, towels, bedding, things like that, to keep from spreading it within your own home.
Okay, Doctor, we've gotten a viewer question from several grandparents who are in their 60s and 70s with underlying health conditions. They say their grandchildren are out of school and they're going to stay with the grandparents to help out mom and dad who are still working. Do you think that's a good idea? Should they do that?
If they really do have serious health conditions and they're over the age of 65, or they have, or they're immunocompromised in another way, then the short answer is likely no. And so I'm going to say that first. The best thing to do is to stay away, because my new mantra has become, together we are better apart. But if you can't do that, then if the parents have to go work and they have no other resources except for the grandparents, it might be better for the kids to come and stay with the grandparents for an extended period of time. So they're not in and out of a household where they might be exposed to parents who are coming and going. So that's another option if it has to be done, is to have the kids come and stay for, 2-3 weeks, whatever the period of time is that we're all under quarantine, and go from there. Making sure you're wiping everything down as it comes into the home and that sort of thing, and washing hands frequently, using more than a sanitizer with more than 60% alcohol, and wiping down all surfaces.
Yeah, and I think that suggestion could help a lot of people, because we know lots of kids are going to be out of school for extended periods of times. Should we cancel routine appointments? Say you've got a dental cleaning scheduled, or an eye exam, even a hearing aid fitting, blood work, mammogram, anything like that. Is that something that we should go ahead and reschedule?
Yeah, you should. I actually just canceled my dental cleaning for this week for this very reason. For two reasons. One, you want to make sure that you're protecting yourself. So if you're walking into a center that's full of sick people, you don't exactly know what's going on. You could be exposing yourself. But for the second reason is that you're freeing up a space for somebody who's sick to be seen. So it goes both ways that way. You're keeping yourself well, and you're keeping others well as well. So, yeah, it's not that we don't want to see you. I want to see all of my patients for everything that they need. But as of right now, we just have to hold off on some of the more routine things until we figure out what's going on with all of this.
All right, and Dr. Alexander, before we let you go, is there anything else that you'd like to add at this time?
Thank you for asking. I think the biggest thing is I know this is very, very hard on all of our communities. It's very, very hard to see places closing because they want to keep people safe. It's hard not to get together with folks and to really truly practice social distancing, but I just can't stress how important it is. It is the most positive thing that you can do to protect this from moving forward and to keep the cases from spreading, from continuing.
All right.
Together we are better apart. Dr. Christie Alexander, thank you so much